Hi folks, Dr. Ed Beyer. Today we're talking about reason number 3 of 22 of why our thyroid function can be depleted or go down. Many patients come to me with underactive thyroid, and traditional medicine really looks at only one of these 22 ways. And let me tell you, folks, people suffer from more than just one reason why their thyroid is going low. The first 4 that I'm discussing all have to do with brain function and the impacts of inflammation and different neurotransmitters on the brain and hormones. Today, poor hypothalamus function due to systemic, or what I mean by systemic is whole body inflammation. Remember now, the hypothalamus is the area of the brain that controls our hormones through the pituitary gland. The hypothalamus and the pituitary gland are like the air traffic control tower of our hormones. And these areas of the brain are loaded with receptor sites for chemicals of inflammation, and those chemicals are called cytokines. So if we are systemically inflamed for whatever reason, these areas of brains don't do very well, and the production of TSH from the hypothalamus will be deficient, and it won't drive the thyroid, and people start to produce low thyroid hormones. And this is never looked at through traditional endocrinology. We look at it a lot because it's a very common cause. So systemic inflammation causes an elevation of these chemicals called cytokines, which causes the hypothalamus to decrease in function. Those neurons get sick, and now you're not able to produce TSH, and now the thyroid goes low. Now, some of the causes of systemic inflammation, so we have to look at this if we're going to look at the person holistically. Gut infections. Those are so common I can't even tell you that probably 80% of my patients who come in have gut infections. Or any type of infection, chronic viral infection, Lyme disease, okay? A lot of people out there with Lyme disease don't know it. A lot of people have chronic viruses, like if they had mono when they were younger, or cytomegalovirus, Epstein-Barr virus, and herpes simplex viruses. Food sensitivities. The food we eat today, folks, is so different than the food we ate 20, 30 years ago. It's been genetically modified, and now we eat it, and our immune system thinks it's foreign, and it attacks it. So every time we eat those foods, and many of us, it produces an inflammatory reaction. We check for food sensitivities on every one of our thyroid patients, and we get wonderful results once we know, working with our nutritionist, what foods to eliminate from the diet. Molds and environmental compounds, leaky gut syndrome, the main barrier between the outside world and inside of our bodies, not our skin, is the lining of our gut. And just basically an inflammatory diet, eating poor oils, processed vegetable oils, things like that, fried foods, all cause inflammation and all affect that area of the brain, causing low thyroid. I'm Dr. Ed Beyer. I hope that helps. I'm going to show you some research studies here where I got this information from. Symptoms of systemic inflammation. We'll show the research after this. Chronic joint and muscle pain. How many people have that? Oh, I'm sore all the time, fibromyalgia, things like that. So besides inflammation shutting down the hypothalamus and the thyroid, it can also cause these symptoms. Brain fog, arthritis, fatigue, swelling of the feet and hands, especially around the ankles, and high blood pressure. Okay, here's the research.